Greetings from London. This is Maryum, Sharif, and welcome to the Star Moguls podcast. Today, I'm joined by a very special guest. We're talking about health in the month of January. Her name is Anna Venables, and she is from Microsystems Therapies and Training. Welcome, Anna.
Thank you, Maryum. Thanks for having me.
This whole concept we're going to be talking about is ear seeding, and I have never heard of it.
So a bit of a strange concept if you've never heard of it, Maryum. So the ears are a microsystem of the body and the brain. So we can actually treat the whole body and brain through the ears, through the nerve innervations that come into the ears.
Right, right. So is it like acupuncture?
Yes, it's a form of acupuncture, but it's needle-free, no needles.
And how long have you been doing this?
25 years I've been an auricular acupuncturist and using ear seeds as part of my treatments.
Right, okay. So where does ear seeding come from?
So it's got quite an ancient history and a modern one too. So it's actually steeped in traditional Chinese medicine, as well as other Oriental influences like Korean, Japanese, ancient Egypt, ancient Persia. So it's been around for thousands of years, Maria. Long
Wow.
time.
Never heard of it. I know that there's therapies regarding kind of feet because there's certain pressure points on the feet that symbolize our body. Is that the same kind of concept then?
Absolutely. So the feet are a microsystem of the body, as are the ears and
Right.
hands. So we can use the ears actually to treat the whole body and brain. It blows your mind a little bit, but yeah,
It is. Like,
absolutely we can.
yes, it is mind-boggling. So why would we want ear seeding anyway? What's the benefit of it?
Oh, a couple of really interesting things. So the ears are a window to the brain. So we can actually connect our body and brain by just applying pressure to the ears. So we imagine that a map of the ear in the form of an inverted fetus, an upside down baby, is projected onto the ear. And by using that, we can actually hack into the nervous system and we can really help with stress, anxiety, and we can also influence the brain and brain chemistry too. So it is a gateway for supporting wellness and health in a multitude of ways.
When you raised your ear, I actually then physically, then I was like, okay, now I can see the similarities. That's remarkable. Wow.
Absolutely. So it takes a while to visualize to get your head round, but just on a very simplistic level, if you imagine that our earlobe is the head and the brain, and then the spine curves around here, so this is our vertebrae, and the feet and the legs tuck in here, and all our organs are inside here.
So what can you help people with?
Well, there are different grades of evidence for ear seeding. We do have some very robust evidence too. It's particularly helpful for anxiety and for stress. It's got great evidence base for sleep as well, insomnia, and weight loss, Maryum. We're in the new year. That might be quite a useful one for people. There are some really good, robust evidence for helping certain points on the ears for weight loss. Like this one here where I've got my little diamond tea, ear seed. So it can actually help with feeling full, that feeling of fullness, and reducing the appetite, reducing the hunger, but stomach disorders as well. And the beauty of ear seeding is that we're not only treating on a physical level, but emotional too. So we know that we can actually influence our hormones, so it can help with menopause. Any symptoms actually that where our hormones are out of whack, we can really help balance and regulate the system.
So can you help people that are women, especially that are going through like kind of menopause or hormonal changes?
Absolutely, yeah. There's the most phenomenal point. If I can show you on my ear, or I do have an ear model that I use
Yes,
as well.
that might be better. Yeah, that might be better.
You might be able to see a bit clearer. So one of the brilliant points for menopause, for balancing hormones is just here, right in that little groove there.
Right.
If you have a little
Yeah.
feel,
Oh, yeah.
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 So this is called the intertracheal notch here. This is our master endocrine point, and
Okay.
it is brilliant for putting our hormones back into balance. And some of the symptoms of menopause, in particular, those hot sweats, and some of the brain fog as well. Some points that are amazing for brain fog relating to menopause too.
How did you start this then?
Wow, I worked in natural therapy since 1999, and then I actually got into ear acupuncture and ear seeding by chance. So I went to work. Well, I was invited to work with substance misusers, young people,
Right. Okay.
so teenagers with drug and alcohol issues. And as I was a reflexologist and a aromatherapist, I was asked if I would work within the substance misuse service. So I went along, became lead complementary therapist. And then, whilst I was there, I actually trained in what's known as the NADA protocol, which is a worldwide known protocol to support detoxification
Right.
from drugs and alcohol. So I learned it, I was trained in it in the early 2000s, and it absolutely blew me away. It completely changed my therapeutic trajectory and my work. And I've been obsessed with these ever since, Maryum,
Yeah.
25 years on.
If I was to come to you, because obviously I'm going through kind of my menopausal stage at the moment, what is it for someone like me that you would recommend then? How would you take a client, and what is it, that kind of whole process of this kind of treatment?
Well, treatment is always best individualized
Right.
because we're all different and both ears are different. We present
Yeah.
the ears would
But
tell you what's happening in the
is
system.
there something that is the left, uh, does it signify something and the right signifies something?
It can do, yes. So certainly energetically it can, but
Oh,
usually the left and the right tend to follow the physiology, the
oh,
pathology of that side
right.
of the body. But so individualized treatment is always best. So
Yeah.
one of the things I do alongside a full consultation with you, Maryum, is I read your ears. Another mind-blowing concept, because the ears would tell us what's happening in our system just by visual inspection, just by looking at them.
Yeah.
We can look for different anomalies, manifestations on
Yeah.
the ears, and we can tell. It gives us signals about what's happening. The ears got its own language, so we just have to learn the language of the ears, and it gives us a really good guide as to what's happening in your system, alongside obviously your reporting on what's going on for you as well.
Who will benefit from ear seeding?
Anybody benefits from ear seeding because
Is it a certain age or a certain
there's
no?
no age limit to ear seeding. It's gentle, it's non-invasive, it's natural, and it's needle free. The only age restriction I would say is because the seeds come on little pellets, we want to avoid any risk of swallowing. So very young children at that age too. But other than that, it can be fantastic to help with sleep and to soothe and to calm our nervous system, because one of the brilliant ways that we can actually hack into our nervous system is through the ears. The ears is a gateway, particularly through some of the nerves that are innervating in the ear. That is our way of accessing the nervous system. So it's very calming, soothing, great for stress, anxiety, but anyone can benefit from ear seeding.
Is there any kind of side effects? Is there some people that shouldn't be doing it?
There are very few contraindications, as it were. Sometimes we have to be a little bit careful when people are pregnant, which acupoints we use on the ear. So
Right.
up here in our triangular fossa, we've got our uterus points up here. So we'd have to be a little bit careful up there. Um, People with metal allergies, because the seeds, we can get gold and silver, and so obviously people with metal allergies, that's something that we'd have to factor in. And also they do come on hyperallergenic plasters, but you would need to just check out whether you're allergic to plasters as well first to see if they'd suit your skin.
So besides the application, there's no other side effect from seeding. There's no overdose, or there's thing that can happen to us if we have ear seeding. There's no
No,
other side effect.
no, there's no other side
Amazing.
effect. Probably other than sometimes the ears can get a little bit sore.
Right.
So if they get a little bit sore, you would just simply remove the ear seed.
Yeah.
The other piece of advice I give to people is not to leave the ear seed on the plaster on for longer than about 3 to 4 days. And that's only a hygiene issue because of risk of infection if the plaster gets wet. We always need to apply our ear seeds to a clean, dry, and antibacterial. That's very important. That our ear is antibac before we pop the ear seeds on.
If I was coming to you, Anna, for ear seeding, what is the process and how long does it take? And what are these ear seeds?
So a course is always better because with ear seeding, we're applying continuous pressure. So we
Right.
seem to get the effects over time. That said, however, as soon as we apply an ear seed, got my little pearl ones in there, we can get an instant result as well. Because one of the ways that ear seeding works is by activating some of the nerves that innervate the ear. So we can get immediate results, but I would say a course is better too. So I would take you through a process of a consultation first. So we'd really get a good understanding of your health and your wellness goals, what you'd like to achieve out of your ear seeding session. Then we do some ear reading. So I can actually really take a look at your ears, do a visual examination, and actually the ear will tell me a lot of information about what is going on in your brain, in your body, and your health.
Right.
And then I would do an online one-to-one bespoke session with you, whereby I would devise and create an ear seeding protocol especially for you based on your wellness goals and whatever support it is that you need. And also guided by the ear too, because the ear is always final guide. The ear will tell you what's happening in the system. So I would then create you your own bespoke protocol, ear seeding protocol, provide you with the ear seeds. We have lots of choices or lots of different types to suit each person. And then we'd meet weekly, we'd have reviews and see how you're getting on with your ear seeding at home, any tweaks we need to make, how you've experienced it. And because I'm also experienced in behaviour change, I worked in addictions for many years, we can also apply a little bit of motivational interviewing and CBT to help you with any triggers that you've got as well. So it really is down to what your wellness goals are
Yeah.
and also what the ear is saying, what the ear is telling us. So it's a very individualized treatment.
Okay, so let's talk about the seeds that you have because I don't really want to be planting anything in my ear. I was like, what are you talking about? Seeds? Like, literally, are you putting seeds in your ear? Like, can you explain that? I
I
don't
think it needs
understand.
explaining.
Yeah.
So the seed part of it is coming from these that are traditionally used in
Right.
acupuncture. And this is the Vacaria seed coming from the Vacaria plant. So that's where the term the seeding has come from. So the Vacaria has a slight stimulating property. So we're using acupressure. So what we're doing is we're applying these to the ears and then we're rubbing them. And it's the act of rubbing the active acupoints that are stimulating the nerves on the ears and sending messages to the brain. So
Do
those
we? So that's not a seed. That's a plaster attached to it, is it?
absolutely, yeah. So there's a
Yeah.
seed, bit of a
Okay.
close up,
Yeah.
and it comes on a backed plaster. So you
Okay.
just peel it off
And
and
then it's the
apply it.
rubbing of it. Yeah. So it's the rubbing of the actual seed on the ear that will activate whatever part of the body that we need to heal.
Absolutely, you've
Right.
got it.
Okay. Okay.
Yeah, and I'll show you some more because we've got different seeds that
I
work
was
in
saying
slightly different
I'm
ways.
really someone who would wear, because obviously I'm brown skin and it would show up. So how would
Yeah,
I wear that? Because I don't think I'm
yeah.
out and about on social events and whatnot, and I don't want plasters in my ear, Anna.
No, of course
What
not.
what
No,
else?
well, we've got some
You
more
said you had a
discreet.
pearl, didn't you? You had a pearl.
Yeah. So we have some more discreet and more aesthetically pleasing
Yeah,
options.
yeah.
So these are very popular. These are gold. So we can get 24 karat plate gold. And they're coming on the backing plaster here is clear, it's
Oh,
transparent.
okay,
So
yes.
it'll blend with your skin tone. So
Mm.
these are much, much more discreet.
So my question is that can we reverse the plaster on the back of the ear? So
Absolutely.
instead of, I'm just thinking, because I don't want to wear it on the front, but maybe would it help? Would it do? Because it's the same points, isn't it? So we're just kind of using it on the back side of the ear. So
Yeah.
yeah,
Absolutely, it's
yeah,
really versatile. A
yeah.
really good way of finding it is if you just use your thumb and your pointer finger and you find the point on the front of the ear and then match it with your thumb on the back, and then that is the point that you're using. So, yeah, if you want to be really discreet on your date, Maria, then you can use the back of the ear too.
You
And it's doing the same thing as long as you remember to give it a little rub.
absolutely honest. I've never even looked at my ears. Ears are the last thing I'm looking at. But you've made me aware of them. You've made me aware of my ears and how to find that point.
So, paper ear charts are really limiting, they're static. It's really hard to figure out from a piece of paper where
Yeah.
the acupoint is. So, one of the things I do is I actually teach you the anatomy of the ear. I mean, I have an ear module that I use to make that visually clearer. And I can then, when I show you a very simple concept of an ear map, it becomes pretty clear, and anybody without a lot of training can figure out the area on their ear
Right.
where they would be, and anatomically,
And
absolutely.
how many do we need? Are there a maximum or a minimum that we need to activate or is it regarding our own health? Is there a maximum that you put? Because you could have like a decoration in your ear. So are there any number of seeds that you're going to be using?
I would say about 5 on each ear, probably no more than that. I mean, there are over 200 acupoints on the ear,
Yeah.
actually.
Oh
But
wow.
we don't want to wear 200. I mean, we'd weigh quite heavily with that.
Right.
So we want to just have a really clear, targeted protocol. That's why we have our individualized sessions, because we're meeting with whatever your wellness goal is. So I'd say about 5 on each ear. So those are the gold. And we've also got some nice crystal diamante there. So
Okay.
it depends how discreet you wish to wear them. These are teeny tiny, these gold. They're much more discreet. Some people like to wear these as healing jewelry because these are nice and blink. They really do look like earrings. You can see that I've
Yeah,
got a
I
pearl
had
there.
people wearing earrings. I was
I
like,
know. I've got a diamante one just there, which is on my
what
hunger
points
point.
then? Yeah, what points are you wearing at the moment?
Okay, so this is a hunger point or an appetite suppressant point.
Okay.
So post Christmas, very useful, actually reduces down the appetite. And these pearl ones are actually positioned in the more traditional point where people tend to get their ears pierced,
Yes,
usually the
yes.
first time.
What is
This
that
is
point?
actually at eye point. So
Oh,
this
is that eyes?
our eyes, this actually enhances our vision at eye point. This, and I'm of a certain age, Maria, long-sighted, short-sighted. It's all a bit mixed up. So these really do help with my vision. And there's a nice little history behind this point that not that too many people know actually. So this eye point was actually used in the 19th century by Mediterranean sailors, and they used to apply ear seeds or acupressure, a form of, on their eye point here to help with their vision.
Oh,
That's
wow.
how that came about.
Oh, wow. So those who have piercings, like, if you have like two or three piercings in your ear, does that affect your like the process? Is that and those who have multiple ears that are, not multiple ears, but multiple ear piercings, does that affect the ear in any way?
Absolutely, it doesn't, and it affects the energy pathways. So, an Oriental point of view would be the meridian pathways, the energy lines on the ear. So, when
Right.
you first have your piercing, because a lot of people very commonly get their daith, they call it the DATE for migraines, because then it's coming here in by where the vagus nerve innervates. So this is a very, very important nerve because it really is calming down our nervous system very effectively. So when people get their vagus nerve or their DATE pierced, it is actually being helpful to begin with because it's activating that acupoint. But then over time, what happens is that becomes less effective. But all that happens is the active part of the acupoint just moves. So it'll just surround, it'll move alongside the piercing. But within kind of traditional Chinese medicine, it can cause energy blockages, the piercings as well. So if people are having problems, if they remove their piercings, they might find that it helps with that energy pathway, the meridian pathway being clearer and the qi being able to flow along it a bit better.
Right. So it's energy and healing. So it's a emotional and kind of a physical healing.
It's a science and an art, absolutely. So we're always working in an energetic way and an emotional way, as well as a physiological way too. So it's a bit of a catch-all ear seeding, really, because we can also treat the emotions as well. And particularly in traditional Chinese medicine, the organs are linked to emotions as well. And one of the beauties as well of being able to access the brain on the ear, we can get really, really precise. We can actually access the limbic system. We can access the frontal lobes as well. And we can really dig into the neuroanatomy, which is particularly the German system and the French system. And we can really support things like ADHD symptoms, brain fog. So we can actually change the neuroanatomy through some of the brain points in the ear.
You said a German system and a French system. I thought it was a Chinese system.
It's very confusing, isn't it? Absolutely. Yeah.
What
So
system? Yeah.
yeah, lots of different systems, and it can get confusing. Slightly different maps with the different systems. So the German system really focuses on the neuroanatomy in great detail. So the leaders of the German system would be Dr. Barr and Dr. Strickmatter. Now, Dr. Barr worked alongside Dr. Paul Norchier, so he's the person I introduced right at the beginning when I introduced you to the inverted fetus ear map. It was actually Dr. Norchier, a French neurologist, who figured that out in 1956. So, as I said at the beginning, ear seeding, ear acupuncture is not new, but the ear map that was used in inverted fetus pattern is, well, it was 1950s. So that kind of diverted ear acupuncture and ear seeding away from more traditional Chinese medicine. And we mustn't.
You're practicing what then? You're practicing the German or the French, I think, aren't you?
I integrate both.
Oh, okay.
I integrate the East and the West, the Oriental and the modern, because
No, I mean, as in German or French.
absolutely. So the French would be using this map, and the German is a different map. So lots of different points to use. And then Chinese, there can be some differences as well in the maps. So because of my training and studying with some of the best auricular medicine doctors and professors in the world, I'm lucky enough to be able to integrate the different focuses of the different systems and make that really bespoke for the person that I'm helping to get that really targeted wellness outcomes for them.
You said it was instant. So you put the seed on and then it's an instant relaxation or instant relief from a migraine.
Well, as soon as we activate the acupoint, we're doing something.
Right.
We're sending a message to the brain. We've got a very clear, evidenced ear-brain-body connection. We know that from functional MRI scans. We know that when we press a point or apply an ear seed or an acupuncture needle, that we're actually targeting and influencing points in the brain that relate to the point that we're accessing on the ear. There's a point for point correspondence between the two, between the ear, the brain, and the body.
Great. So, how long will it take for me to say I've been suffering from migraines a lot last year, and I actually got my eyes tested, so we'll be coming with my new glasses. But what can you do for migraines? Can you cure them?
I wouldn't use the word cure ever, but ear acupuncture and ear seeding has a fantastic evidence base for migraines.
Okay.
So I would recommend a course of 12 treatments if you're
Oh,
doing your one-to-one bespoke ear seeding with me. If you're ear seeding at home, because it's simple enough to do at home as well, once you know what protocol to use, it's individualized to you, you should feel um, a relief on the same day, certainly within a few hours. But because the way ear seeding is working, it's applying continuous pressure. And of course, it depends what the cause of your migraines are, because the causes are very complex.
yeah.
Over time, it should really help reduce some of the issues that you have with migraine, because ear seeding and ear acupuncture is fantastic for pain as well. It has a brilliant evidence base for pain. So it depends what's causing your migraine. Obviously, anything to do with the head, you're going to want to get checked out by a medical professional. But
Yeah.
there's a brilliant protocol along here called, I call it my headache line. And there's 3 points that come along just under this little mountain range here, which is the antitragus. So you can actually treat yourself at home as well for migraines and headaches really
Right.
effectively.
When we combine the points, are there certain points that we can't match together in one session? And would you heal multiple issues in your health altogether?
Well, some points have real versatility to them. So, for example, the master endocrine point, which I'll show you on my ear model here.
Yeah.
This is a really versatile point for people with hormonal issues. So this can really help with menopause, but
Okay.
can also help with things like polycystic ovaries.
Oh,
Anything where our hormones are completely out of balance, we
right.
can apply an ear seed. It's a bit of a tricky area actually to apply to, so you definitely need one of the smaller discrete gold ones. And you can apply an ear seed here, and that will help regulate the hormones. So it's covering lots of things in one. It
Right.
always depends what the cause is, doesn't it? Because, so for example, this would be a point we'd use in a weight reduction protocol as well. Well, it depends what the cause of the weight is. There are lots of different issues. It could be due to your polycystic ovaries, but it could also be due to your stubborn postpartum weight. So we have points that we can use on the ears that are really versatile.
Right.
And we have much more specific points as well that we can use in a really targeted combination. So we have points that work really well together.
Together,
So, for
yeah.
example, if we're doing a weight loss protocol
Okay.
and we're trying to help with our appetite and hunger to suppress it, there is a protocol that we would use, which is what I call my belly full protocol. And they're points that link really nicely together to do the job that we want. So
Right.
one of the points is actually here where we've got this yellow coloured pin, and that is our appetite suppressant point or a hunger point or a satiety point, which means feeling full. That
Mm.
goes really beautifully with the green one here, which is our stomach point. And again, that's a really versatile point that helps with hunger management, but other stomach disorders too, and digestive issues too. So we could pop that with a small intestine or a large intestine point. That's really going to help regulate our bowels, particularly if we're constipated or we have diarrhea. It's going to really sort that out. This point here, the orange pin here, that's our thalamus point, and that really helps with our water electrolyte balance. So
Oh,
this
right.
combination that you can see here is one that I put together. It was actually a bespoke one that I put together for somebody to
Oh,
help with their feelings of hunger. So to help reduce the hunger and to increase that feeling of fullness, as
oh,
well as really helping their digestive system to work much more efficiently and effectively. and their water electrolyte balance too.
Certain combination points work well together, but are there certain things you will never put together?
There are certain areas which we would avoid based on conditions. So pregnancy, for example, really important. If I show you with my ear model again here, this part of the ear here is called the triangular fossa. I like to think of it as a thumbprint, like we're making an imprint into the ear. So this black pin here, this is an amazing point. This is called Shenben, which means gateway to the spirit. This is very calming for us.
Okay.
But if we go in a bit further here, this is where our uterus is. So this is where our gynecological points are. So if we are pregnant, we'd need to make sure that we steer clear of going further into the triangular fossa here. But this is an area that massively shows up on visual inspection if there are gynecological problems with people. You get what are called comedones. So they're like gritty, grey, textured spots, and they often run in a line along here. You also see really acute inflammation in this area with people with gynecological problems as well, and they'll often be bright red and bright pink, and you'll have quite an uneven texture to it as well. So the points that will really help balance some of these gynecological conditions and disorders, but you'd need to go further in, steer clear during pregnancy of doing that.
I know some of my friends and their children have ADHD, they're autistic. So could you help in that sense?
Absolutely, we
Yeah.
can. So there's a great evidence base for ear seeding that really helps with some of the unwanted effects of ADHD and
Yeah.
executive functioning as well, because ADHD is an executive function disorder. So we are very much able to influence our limbic system here. And actually, these black marks that are on my ear model are actually our cerebral lobes in the brain using the map of the German system. So I have developed a fantastic system and program to support ADHD and executive function challenges that is adaptive to the individual, because no two people present with symptoms of ADHD or executive function challenges in the same way.
Right.
So within the system that I've created, there are actually 4 different protocols that you would mix and match, that you would adapt according to what somebody is experiencing and no longer wishes to. So it can really help with things like working memory, but it can also help with impulsivity and anxiety and the fight or the flight that's very much linked to the hyperactivity side of ADHD as well. So what it's doing is it's linking our neural networks, our brain circuits, and it's calming down our limbic system. It's really helping those messages and some of the neurochemicals like the dopamine and the epinephrine get through to the frontal lobe, which is here, to our thinking brain, so that we calms down our impulsivity in our doing, so that we can think more clearly. It's not possible to do that unless we're really supporting these brain circuit connections. So I call it my connecting protocol for a good reason, because it's connecting brain circuits and neural networks, but it's also about connecting people. Because one of the things I've strongly modeled it on is family dynamic. So it's about caregivers supporting children and children supporting caregivers. So it's an intervention, it's a partnership of ear seeding. So it crosses generations. So the adult can ear seed the child, and the child can also ear seed the adult as well, because ADHD impacts on the whole family, not just the people that are neurodivergent.
Yes.
And let's be clear as well, people usually present with lots of mixed conditions as well. You know, we can have mixed diagnoses of autism and ADHD and anxiety. We're all mixed up chameleons, as I like to call us. But we don't need a diagnosis to be able to use these acupoints that are helpful to us well. Just an experience of the symptoms that we're having, and it will really, really help. And it also helps with family relationships too, which can get fractured through some of the stresses and the strains and the demands that are put on families with neurodivergent people. There's a really strong genetic link in ADHD between parents and children as well. So it may be helpful to the adult that doesn't necessarily have a diagnosis too, but would be experiencing similar things to the child that may have the diagnosis. But what's really important is you don't need a diagnosis. So it cuts across age, it cuts across gender, it cuts across the generations, and it cuts across the need for a diagnosis. But it does very much work alongside a medical model too. So it's not an alternative to, it's as well as getting the best of the both worlds. So the ear is like a computer screen. So we can look and read the ear as a computer screen that gives us these diagnostic signals, as Terry Olson calls them, that tells us what's happening. But we can do more than just look at the ear. We can probe it, we can use an ear seed, we can use an acupuncture needle, we can use our finger, we can use ear massage. And as soon as we do that, we are then activating the active acupoints on the ear. And like a computer, we press a keyboard, one of the buttons on the keyboard, and that's sending a message to our brain, and that's changing our brain chemistry. And it's changing the pathways and the messages that get to the brain in a way that either lights up parts of the brain or actually deactivates part of the brain. So we know this from Romoli and Alamai's functional MRI scans. So in the case of pain, there are actually areas of the brain that when we activate points on the ear, actually become dull, become dimmed. They no longer fire up because the gateway, the message, is being blocked from getting through to the brain. I feel pain. Other times we want to light up those areas of the brain, and we want those connections and those neural connections and those brain circuits and the neurochemistry, and we want to actually reorganize the brain and the patterns that the brain has come to learn. And that's the beauty of ear seeding and acupressure. We can actually reorganize those patterns of the brain, because all you're seeing on the ear in this imaginary map of the inverted fetus is the brain's projection of the body and the brain. So how the brain is visualizing that and how that is translating to the ear.
You were saying that massaging is good for the ear. Can you just give the audience maybe your top 3 tips of ears or ear maintenance? I think massage is one of them, but maybe if you can also give us like a technique of massage and how we should massage and any other tips that you think that would make our ears healthy.
Well, we're doing a whole body workout through an ear massage is what we're doing. So it's important to do the whole ear and not miss anything
And
out.
I lose my calories from just doing massage.
Well, we can try. Well, we can certainly really activate our hunger point here, our appetite suppressant point. But this is doubling us where the vagus nerve comes in from the tragus. So I like to do what I call Spock fingers. And I like to go either side. So we're actually innervating the nerves on the front and the back of the ear too. Okay. So from a Western point of view, we're activating the nerves, the cranial nerves that are coming in. We've got the vagus nerve, we've got the trigeminal nerve is coming in here, the auriculotemporal part of the trigeminal nerve. Vagus nerve is coming in here and it's radiating all over the concha here. And we've got other cervical plexus nerves coming in here. So it's really important actually that we're quite, just knocked off me at Diamante there on my shemme. But it is nice to start at the top and do some nice, deep, slow circles. And this is our helix, our spiral. We can start and go all along the helix. The helix is like a whole body workout again because we're activating our entire system through the helix. So we can start off with the helix and we can come into the concha where our vagus nerve is innervating and we're really calming down the system, and do the upper part of it as well. We can actually do some nice circles in our triangular fossa. This is our thumbprint dip area here. This is really great for our gynecological points here. and your ankle
Oh,
and your
really?
joints as well. Yeah. And as well as deep massaging circles, we can always give our ears a lovely stretch as well.
Oh,
Really not, you feel totally different after an ear massage when you've stretched the ears. But it's important to warm them up as well and get some heat
stretch
going
my
on.
ears.
Stretch the ears. We'll have Spock ears then, won't we? Yeah, give them a nice stretch and a nice pull. Fronts and backs, a nice rub as well. So we've got circles, we've got rubbing, we've got stretching as well. And I'll tell you what's really nice. It looks a bit weird, but you can flick as well. You can actually flick the ears.
What does that do?
That feels quite nice too. So you've got to make sure you cover everywhere and on the earlobes. The antitragus, which is this brain point here, so important to massage this because we're really helping with anxiety, we're really helping the neuroanatomy,
Right,
and
yeah.
inside as well, just underneath there as well, we've got some fantastic points, the subcortex, the thalamus. This part of the ear here is fantastic for anxiety as well. So if you
Right.
come just under this, I call it like a little mountain. If
Yeah.
you come just under it here, this is where our headache points are. Fantastic headaches and migraines. But this is where our limbic system is as well. The points along our limbic system. So if you're heading for the antitragus and the lobe here, you're really helping calm down stress. And our face is on the earlobe as well. So if we're really wanting to help with clear skin,
Yeah.
we'd also be going into the concha here. The lungs in Chinese medicine is linked to nice clear skin. So we could head for the lower part of the concha there, which
And
is
that
our lung. Yeah,
show this on the model. I think that's better.
yeah. I want to show you on the
Okay.
model.
Yeah.
Okay. So anytime we're coming just under our antitragus here, because these are our brain points, we've got brain stem here,
Yeah.
just underneath it here. This is occiput, fantastic for brain fog, also brilliant for headaches and eyesight. We've got our lovely headache and migraine line along here. But these points are also our limbic system. So if we're massaging points along here, we're really helping calm down our anxiety, our hyperactivity, where we're feeling a bit stressed and anxious. So this is a really great mental health. I call it like my mental health area. Low mood, anxiety.
Right.
Head for this area here. And this is the headache, migraine line here, brain stem here. And just up behind there as well is the subcortex, the triple warmer, fantastic. Sanjiao, fantastic for anxiety, for regulating the nervous system. Tragus is really important because this is where the vagus nerve is innervating in like this. The hairy part of the ear, the tragus is known in Latin. That's what it means, the meaning of it. So the tragus is really important that we're massaging the tragus here.
Right.
And we're going inside it as well and just behind it. This is a way of really instilling deep relaxation and helping us to sleep as well.
Oh, really? Oh, I didn't.
Yeah,
Wow.
yeah. And there's actually 3 points on the ear that represents the vagus nerve. Not many people know that. And
Right.
the vagus nerve is carrying all the parasympathetic nerve fibers. It's actually known as our gut brain. So it's our second brain. So we're going right from the gut, and it's actually hitting our cardiovascular system and our respiratory system, and it's coming up here in the throat. So the vagus nerve is really, really important for balancing and regulating our autonomic nervous system when it's out of whack. Also on the tragus here, just here is where our adrenal Chinese point is. So this is very important if we're feeling stressed and anxious. And when we talk about weight gain, often that can be from cortisol. You know, you've heard of
Yeah.
cortisol base.
I think
Ear
that's
seeding can be used to
yeah.
help reduce cortisol base. But
Mhm.
one of the things we need to do in a really targeted way is target the adrenals. Okay, and we can then regulate the adrenal, regulate the production of cortisol, which is out of balance, and that happens with, and that can mean that we can have some weight gain as well as also feeling really anxious. There's also a point for the a European point for the adrenals up here as well, right next to the kidney. So we can use our different systems and integrate the French system, the German system, the Chinese system, all the different systems we've got, we can integrate and get a best fit adaptation for what it is that we would like help and support with.
Thank you so much. It's so fascinating to me, and I think that you can help so many people with such a variety of issues, you know, from hormones and menopause and stress and ADHD. It's fascinating. I am so intrigued by it myself. But thank you so much for being on the podcast. Really have enjoyed it. So insightful. And if people want to get hold of you, how do they do so? Where is your clinic based then?
So in person, I'm in Bourneville, South Birmingham. I have a stunning clinic, which is actually in George Cadbury's former Georgia mansion, overlooking the lake and the mature gardens, really peaceful. Or alternatively, online, head to my website. So
Right.
my website address is www.mt80.uk, and you can contact me there. You can send me an inquiry, we can have a phone chat, and we can get going with your bespoke ear seeding consultation and protocols.
Amazing. It's like a natural Ozempic, isn't it?
A natural Ozempic, I love that, Maryum. Absolutely, it is.
I
Yeah,
love
it's
it. I
working
love
on
it.
those brain receptors in exactly the same way,
Yeah.
actually. And there is evidence to show that. It's not all woo woo. There is some robust evidence to show it.
Wonderful. Thank you so much. And I wish you well
Thank
for this
you.
year and the amazing work that you're doing. Thank you so much.
Oh, thanks for having me, Maryum.
Thank you so much. Take care.
Thank you.
Bye.